The level of involvement in each compartment is essential for the diagnosis. As opposed to other cancers in the skin, the staging in mycosis fungoides ancestry is purely clinical and is also based on the amount of blood involvement that exists, and that is related to the circulation of the neoplastic cells in the blood and the presence or absence of abnormal clinical or pathologic lymph nodes. But the skin evaluation and staging in terms of skin lesions is purely clinical. So patients with T1 or T2 disease typically have skin-limited disease, often with patches more frequently or plaques. The limit and the threshold is the amount of the surface of the body that is involved. T1 is less than 10%, T2 is over 10%. And the brisk transition happens when the patients develop tumors, which is considered T3 disease, and then, of course, erythroderma, which is considered T4. But remember that the staging is really critical at all levels of cutaneous manifestations of the disease. And determining blood classification is really critical in the diagnosis and the staging of these patients. You can see here in this diagram that the TNMB classification combination of the cutaneous, nodal, and blood involvement. And patients who are considered early stage go all the way up to stage 2A. And patients that have tumor stage, those are essentially considered advanced stage immediately by the definition of the identification of the tumor. And then we have the patients that have erythrodermic disease. And of course, the critical step happens when they reach a significant and specific threshold for blood involvement, more than 1,000 circulating malignant cells in the blood, which is considered B2 disease. So why is important to evaluate these patients from the beginning, and why is relevant to evaluate the blood compartment at all stages is because, and this is data that came out from a very interesting paper from the Proclipi study, which is an international prospective study looking at patients with MF and Sézary. They found 1 in every 5 patients that have early stage disease have B1 blood involvement. And we know that those are patients who have a higher likelihood of progressing during the course of the disease. That is why it's so critical.